Hello everyone, this is Dr. Parul Gohi, consultant dermatologist at New Roots Skin, Laser and Hair Transplant Clinic, Bangalore. So today I'll be talking about hair anatomy, hair structure, hair cycles, different phases of hair growth, how it sheds, etc. So let me start with the hair anatomy. So as we know, hair is a dead structure which is made up of a protein called keratin. Now talking about the hair has three coatings. The middlemost part is known as the medulla. The outermost covering is known as the cortex. Now the thickness of the cortex determines the thickness of your hair. The protective layer that is known as the cuticle, which gives the shine, the luster to your hair. And it also protects the inner two layers. Now talking about the hair, the visible part of the hair is known as the hair shaft, and the one which is embedded into the scalp is known as the hair root. Now hair root is supplied with many nerve endings and the blood vessels. That's how it gets the nourishment. Root of the hair is also associated with sebaceous glands. Now sebaceous glands are the glands which produces the sebum, that's the oil, that also nourishes the scalp and the hair. It is also associated with erector pili muscle. Now, this muscle contraction causes a phenomena called as the goose skin or the goosebumps. Now, this entire hair root with the surrounding skin is known as a hair follicle. Now, a single hair follicle can have a single hair, double hair, 3 hair or 4 hairs. Now, this is very important for the hair transplantation surgery. How? That is because if you have more number of hair in a follicle, that is better. That is considered as a better graft. Coming to different phases of hair cycle. So we have, you must have heard, there are different cycles like Anagen, Catagen, Telogen, right? Let me summarize it for you. So we have 3 to 4 phases basically. So there is the first one is called as the Anagen, which is the active growth phase, wherein your hair grows in size and length. Right now, Anagen basically it lasts for about 3 years to 10 years. The length of your hair depends on the length of the Anagen hair. The longer the Anagen phase, the longer your hair will be. Now, some people they complain that the hair is not growing beyond a certain length. That is because the Anagen phase is very small. How to increase that Anagen phase is by eating and drinking healthy, sleeping well, avoiding stress, exercising, avoiding smoking and alcohol, etc. Next comes the catagen phase, which is the involutionary phase or the resting phase, wherein the hair follicle shrinks in size and it is preparing for the shedding phase. Okay, now that lasts for about 3 to 4 weeks. Then the next is the telogen phase, which is called the shedding phase, wherein your hair is going to shed. Okay, it is going to come out from the root. So that lasts for about 3 to 4 months. In a healthy person, about 80 to 90% of the hair at any point of time is in the anagen phase. That's why you have hair on your scalp. Now, if this ratio reverses, that means if you have more telogen, if the hair is in the telogen phase or in the catagen phase, then you're going to shed your hair more. That happens in the conditions called as telogen effluvium or post-chemotherapy and etc. Now, if you have about 100 hair falls per day, that is a handful of hair, that's considered absolutely normal. If you have anything more than that, then you need to visit a dermat to get your blood tested, maybe for your any deficiencies or any other conditions. Okay, that's all for today. I hope you liked it. Follow for more. Thank you.